currently happening at the Pumwani Hospital.
Well, good afternoon to you. We are at the Pumwani Hospital, and we know this is the birthplace of legends. Over years, many people have been born in this place, so it is a very active place, having a total staff of 239 people. But the issue of COVID-19, especially on healthcare workers and how it affects them, has been very key, and it has been a point of notice for majority of the presses that we've been seeing on matters health. Now, the situation about Pumwani Hospital, the number of people who've gotten COVID-19 in Pumwani Hospital, that is, the staff is 41 in total, and of the 41, 19 are healthcare workers, those are professionals. Then we have 22 are supporting staff. So from the kitchen, we also have one driver. All this, they have been affected. So 41 is the number. And all these people are doing what you call home-based care. They are self-isolating at home. Now, you ask why the response has been that way. Is because majority of them are asymptomatic. So you have COVID-19, but you're not showing the signs. So the testing that has been happening amongst healthcare workers has been very key in ensuring that also healthcare workers, you know, the statistics are put. So in the country generally, we have a total of 429 healthcare workers who've gotten COVID-19, and majority of them are receiving the necessary support to make sure that they recover. On the Pumwani situation, of course, you ask, it is a maternity hospital. How many children have been exposed to this? How many mothers have been exposed to this? And the number is no children have been exposed to COVID-19. But speaking of mothers, 3 mothers have been exposed to COVID-19. That is according to the communication that we have gotten from the Ministry of Health. So that is the situation at Pumwani Hospital. I told you that 239 people are employed in this hospital, and only 100 are working right now. It means that the hospital is functioning at, half capacity. So it will be a collaborative effort to make sure that also other hospitals are supporting. Only for emergencies are people allowed to come at Pumwani Hospital. But at this particular moment, this is what the health officials had to say earlier on.
Mwambia siende, niko na swali.
To other staff in other departments, including kitchen, support staff, and so forth. I just want to assure members of the public that any staff who was found positive has been put in isolation, following counseling, of course, as per protocols. Most of them are having a self-isolation in their own homes as per protocols and guidelines. But a few of the deliveries, normal deliveries, to assist Pumwani due to the shortage of staff as a result of the isolation and the quarantine of the contacts.
We have had fruitful discussions with the hospital management team, the measures that we need to put in place, including infection prevention control like what you are seeing there. And I've been assured that we have sufficient quantities of PPEs, personal protective equipment. Further, we have agreed that beginning today, we will have an isolation center dedicated for staff of the hospital at the School of Nursing for those who may not meet the criteria for home-based isolation. So basically ours is a mission of support and also fact-finding to be able to see what is on the ground and to assure the public that we are doing everything possible, one, to stop further transmission of infection to the healthcare workers, but also the people who come to seek services here. So the hospital is safe. The staff who are working here are properly trained, and will continue to give them support in terms of capacity building, in terms of proper gear, in terms of infection prevention control measures, to ensure that as they work, they are not only safe when they are offering the services, but they also offer safe services to members of the public.
Noah, before I let you go, you're a man on the ground. Talk to us about paint a picture for us of the situation at the hospital, because you told us 41 staff have tested positive for COVID-19. And as you told us before, this is a hospital that sees a lot of people go there. But today, or the hours that you've been there this morning, have you seen perhaps a reduction in numbers of people who are going to seek services at the hospital, Noah?
Well, surely, you know, there is normally a lot of traffic here, Grace. I remember close to 11, 12 years ago, I volunteered with Pumwani Hospital, and it is a busy hospital. This is not the situation. This is not the normal situation that we normally see here. But today, it is pretty chilled. Sincerely, it's pretty chilled, very few activities. Remember, they have issued a notice saying that we only deal with emergencies. Now, initially, Pumwani Hospital was the place to go. If you want self-delivery, of course, there's been issues here and there, and they're being streamlined. But right now, it is a chilled environment, and basically, even you know, the ambulances are just parked. That is to show you that we are relaxed, we are chilled, and it's operating at half capacity, 100 workers out of 239. So no much activity. Security is beefed up. When you go at the gate, actually, if my cameraman can just pan towards the gate, is ensuring that anyone who's coming in is properly cleaned. So you wash your hands with soap. You know, the basic principles of keeping COVID-19 at bay is being undertaken right there. So that is what is happening here. No much activity, and you have to have very valid reasons to be coming back, you know, or coming into Pumwani Hospital. But as you say, the issue is making sure that our healthcare workers are protected. And Grace, the biggest question, in fact, in the briefing this afternoon, should be how, whether we have statistics on healthcare workers, those who are vulnerable, who have underlying statistics. Does the Ministry of Health have that particular, you know, statistics to know that, yes, these are the healthcare workers, and these ones are the most vulnerable? So how do we address that? Also, the availability of PPEs is the biggest question that should be discussed. But as per now, that is the situation on the status quo. Over to you, Grace.
Indeed, Noah, thank you so much for that detailed report there. Our very own Noah Kipkemboi coming to us live from the Pumwani Hospital, where he tells us that about 41 staff have tested positive for COVID-19. So we're taking a shot.